You know, there's a lot of buzz around questions like, does eating too many sweets cause diabetes? Surprisingly, it doesn't
That's
directly,
interesting.
right?
So essentially, it's not the sugar itself, but more about what it leads to, like, weight gain.
Exactly. When people overindulge in sugary or fatty foods, they risk obesity, and that can raise the odds for type 2 diabetes.
Yeah, got it. And what about rice? I always wondered if it's safe for diabetics to have a serving here and there.
Right, so rice can be enjoyed, but in kind of small portions. They suggest like a handful by mid-morning and maybe 2 by early afternoon.
That makes sense. So it's more about moderation than a complete ban, huh?
Absolutely. Now, when we talk about insulin, many think that starting insulin means a diabetic's condition is super dangerous.
I've heard that. But that's not really the case, is it?
No, not at all. In type 1 diabetes, insulin injections are a must because the body just doesn't make enough of it. And for type 2, it could mean adjusting the treatment plan, but it's not an immediate sign of a crisis.
Right, got it. Something else that's pretty alarming is the idea that diabetics often end up going blind or losing their legs.
Yeah, that's a big one. But it turns out that with proper management, keeping blood pressure, sugars, and weight in check, most can avoid such severe complications.
Exactly, And regular checkups play a massive role in all that management, don't they?
Precisely. An annual diabetic health checkup can really keep things in balance, catching issues before they snowball.
Absolutely. I also came across advice that eating very little might actually spike blood sugar levels. That sounds counterintuitive.
Yeah, it might seem odd at first, but when diabetics skip meals or eat too little, the body starts breaking down fats and muscles, which can actually worsen blood glucose control.
I see, that's kind of like a double-edged sword. Exactly, a real catch-22 situation.
So, the guidelines suggest that diabetics should eat small, balanced portions every 4 hours. It's like feeding the engine just enough so it runs smoothly without overheating.
Yeah, that analogy really clicks. But don't you think dietary advice should get a bit more personalized? Not everyone's metabolism is the same, right?
You're totally right. These are broad guidelines, and individuals might need tweaks based on their own health. It's always best to consult a specialist.
That's solid advice. And speaking of specialists, it's great there are experts like Dr. Debabrata Sarkar out there who can provide more tailored guidance.
Exactly. His clinic and website offer detailed insights. If anyone has doubts or needs personalized plans, reaching out to his e-clinic is a smart move.
Absolutely. It's like having a roadmap for your health. It turns those confusing symptoms into clear next steps.
Yes, and it reminds us that understanding the nuances matters. Sweet foods don't cause diabetes, but overindulgence can trigger risk factors, and managing portion sizes is key.
Yeah, exactly. It's all about balance and informed choices, isn't it?
Totally. And it's kind of like tuning an instrument. You've got to find that right level so your system plays harmoniously.
I love that analogy. So, the take-home message is to eat in moderation, keep regular checkups, and always listen to your body.
Absolutely. And if anyone needs more detailed info, reaching out to experts like Dr. Sarkar can make all the difference in managing diabetes effectively.
Right on. Fascinating discussion. Here's to making informed choices for healthier lives.